Let's look a little bit at screening in this first audience response question. In which one of the following immunocompetent patients is a Pap smear recommended? A, an 18-year-old with 3 lifetime sexual partners, a 19-year-old prior to initiating oral contraceptives, a 17-year-old with 2 lifetime sexual partners who is yet to receive the HPV vaccine, a 21-year-old with 1 lifetime sexual partner, or an 18-year-old with a sexual partner recently diagnosed with gonococcal urethritis. First time Pap smear and the recommended age and the influence of sexual practices prior. And the correct answer here is D. And the point that is being made here is that cervical cancer screening is recommended at 21 years of age for all immunocompetent individuals, regardless of the age of initiation of sexual activity and regardless of the history of the number of partners. Recommendations include repeating screens every 3 years and screening even if sexual abstinence is reported. So why begin at 21 years? This allows for a several-year window before 25 years of age, which is the age at which the risk of cervical cancer begins to increase. Remember also that co-testing with both PAP and HPV is not recommended. Screening prior to 21 years of age, again, regardless of sexual history, will likely detect transient HPV infections and lead to unnecessary interventions which may compromise the cervix and even increase the risk of preterm birth. So this is the answer as to why delay to 21 years of age. And again, that still gives you that 3 to 4 year window that I mentioned earlier, up to the age where the risk of cervical cancer begins. So intuitively, it might not make sense to ignore the particular reports of sexual activity, but that is the recommendation. Now, what about cervical screening for patients who are HIV positive or immunocompromised? This has recently been updated, and recommendations now align with those recommendations for people without HIV. In other words, begin screening no sooner than 21 years of age, and if at the time of HIV diagnosis, the individual is less than 21 years of age, then screening is not recommended. But the follow-up is different. Remember, I said earlier that follow-up for an immunocompetent individual is in 3 years. However, the cervical cytology follow-up should be every 6 to 12 months for a total of 3 years in people who are immunocompromised or in people with HIV. And any abnormal tests should prompt a referral for colposcopy. So cervical screening, same age groups, but different follow-up when comparing those with immunocompromised states and those without immunocompromised states.